his time, I'm going to start with our guest and our mayor of Traverse City, Jim Crothers. Jim, thanks for being here and just gave us a chance to hear from you. Maybe ask a couple questions about how things are going. So thanks for being here, Mr. Crothers.
Sure, Chris. Thanks for inviting me, and thank you all for the work that you do. I mean, I know your jobs were difficult before this crisis, and I'm sure they're made even more difficult with the challenges that we're facing with, having to, stay at home and deal with our client bases that are challenged and the increases in alcohol consumption that we're seeing throughout the loneliness people are sharing at home. So the work that you do is extremely important. I've been tied to your organization for many, many years. I remember back in the day when I was running the HIV wellness organization, we used to do HIV outreach in the Cohasky and Phoenix Halls programs. So I'm well aware of your programs. We know that alcohol is a serious issue in this community, especially because we've become quite a boozy town with all of the recreational drinking that's available to people here. And some of you might know that I'm involved with Dan's House, which is our wet house here in Traverse City that we've allowed our guests to consume alcohol while having a life off the streets. We've seen some pretty good success with that. We've expanded the program. We now own the building. We own both sides of the house, so we're able to offer more bed space. So we're extremely happy with that, but it's been challenging for us because we've had to limit visitors to our facility there because transmission of this virus is very, very easy, and I don't think everybody understands that. I think most of you all know that there's a science behind all this, and we're all trying to collect the data and support. I mean, I'm very supportive of our governor and the regional governors of the states around us that are trying to combat this virus with science and data, and hopefully we could start opening slowly. And I think that's what our governor is trying to do, is work to slowly allow more business to open. No one wants our economy to fail. No one wants our community to be closed. We're all frustrated that our festivals have to be canceled. It's really sad to drive downtown and see everything closed and it looks like a ghost town. Very frustrating. This message that one party is pushing this over another party and where we want this to collapse, that's just not true. It's just not fair. It's not true. Sadly, it's become a political issue across this state and across this country. But I think if we all work together, put our heads together, we could get past this. And hopefully by midsummer, we're going to see a little bit of change. I think the governor is willing to open up a little bit more as we see our numbers stay flat. Not everybody realizes that our care facilities at Munson Hospital and McLaren up north, we have very limited bed space and ICU bed space. So that's the reason we can't really invite all of our summer people here right now. We know they're coming back. It's a challenge, but as long as people shelter in place for a couple of weeks, that's good. Hopefully be okay. But if we do see any spikes, we're going to have to close things down again. I do know the county commission, Grand Traverse County, has a letter from Gordy LaPointe on their agenda for tomorrow, and they want to send a message to the governor that they want to open up for business. Well, we all want to open up for business, but we want to wait till it's safe. And you all are challenged because you deal with very vulnerable populations and you're putting yourselves at risk. But I just want to really thank you for the work that you're doing and the support that you give this community, and that you're working with some of our most challenging individuals. So thank you. And it's difficult, but I think if we're all together, we're all on the same page, we can work this out. It's going to be difficult. None of us are happy that our paychecks might not be coming in, our rents are still due, our mortgage payments are still due, but with any luck, we can get past that, and hopefully with some better aid from the feds, we're going to be able to have better programs available to people that won't push them completely off the edge in debt. So we're doing everything we can. Traverse City, I think, is being really mindful of the stay-at-home orders. Some of you may know that we're trying to do a little bit more with opening up, letting people get outside, enjoy the streets. I mean, I know Commissioner Walters has been pushing for us to do a more active a program where we close our streets and have people be out in them. I've sort of pointed out, well, right now no one's driving around anyway, so it's been very quiet in town, so it's actually somewhat safe to play in the streets at this point.
Right.
But I know the governor doesn't really want us to be pushing platforms where we encourage people to be together, because we still want people to be separate, stay in your home, family units. I did spend a little bit of time going around to some of our box stores a few weeks ago, and I was sort of rather shocked at how crowded the parking lots were, how many people are going into Walmart and Sam's Club and Myers. And I do my shopping at the smaller grocery stores. I've only been out 3 times in the past month and a half. I was someone who did travel. I got back from a planned vacation on March 19th, so I stayed home for 2 weeks, and I've been pretty much staying home ever since. So it's challenging for everybody, but as I said, hopefully we're going to get back to somewhat normal within the next month or so. But it's going to be a long haul. So, but please let me know. I mean, you have the city's support. If there's anything we can do for you, let me know, and we can see if we can brainstorm. I see a few of you got masks on. That's a good thing. I was just given a cherry mask. So.
Nice. Very great.
But yes, but thank you for including me, and thank you all for being here.
Well, and thank you, Mayor. It's been challenging for us, but all of our properties are within the city, and these are our neighbors and our friends, and so and we've appreciated support in the past from the city and the county. The reason we have a syringe program is the city was the first entity that's sort of supported that, and then we had a little tougher time with the county, but they got through, and and so we're still continuing to do that. We're just doing it drive-up services now, so we've had to change a lot of our practices, but appreciate the work you're doing. I know that all the intergovernmental work that needs to happen to manage this must just be daunting, especially when you're having to do it from your home offices. So
it's mainly the crazy negative phone calls and emails. I think there's a concerted effort from, I would say, more conservative states that are pushing people to call the more liberal states with Democratic governors to give us a hard time. I got a weird phone call from somebody today saying they were a nurse, and they said that there's not a problem. Why are you supporting your governor when why are you closing Munson Hospital, and why are you doing all this and that? And when I went and traced the number, and it was a number out of Waco, Texas. So I'm having to think it's not someone local. And I mean, I have nurses that work at Munson Hospital who I check in with every once in a while, and I wrote them, and they said, no, that's totally not the case. Yes, Munson is suffering. The knee surgeries, all the elective services, those are what keep the hospital going. And right now, they're not doing that because they're trying to keep a clean, safe environment for those that are dealing with the COVID-19. But I think through the new executive orders coming out, I think the governor is going to start helping or supporting opening up some of those procedures, as long as we can keep everyone safe, especially our frontline workers. They're the ones most at risk. And right. I happen to have a good friend who's part of the nurses union. She's a neighbor. And so I hear a lot about what's going on at Munson. And I do know Ed Ness personally, so it's a very difficult challenge for them. But hopefully we'll get our feet back on the ground and get Munson operating in a better capacity soon. So
right. Well, and they like us on a whole different scale. I mean, they've done, and I've heard our medical director, Dr. Plum, is online, and she's connected with them. And from her perspective, they've done a really nice job in our community of sort of informing folks and working with their staff, but it all had to happen so fast. So there were bumps that we made, there were bumps that they made, but now we're all sort of getting to manage this new norm, and so start doing those assessments. Certainly. What do you think summer looks like in Traverse City? Best case.
I think summer's going to be quiet. I mean, for some, that's going to be a good thing.
Right.
Economically, it's going to be really challenging and sad because of. We're going to see restaurant closures. We're going to see small retail close. A lot of people are just hanging on right now. We've got a lot of service workers that are struggling because, they were working 1 and 2 jobs. It can be baristas, bartenders, wait staff, whatever, and they have no opportunities. So hopefully things will change, but I have a feeling it's going to be kind of quiet since Cherry Festival's canceled. I mean, Pride was just canceled. Right. I have to believe that Michael Moore is going to possibly cancel the film festival. Iron Man has been canceling all of its new events, but they're not canceling their second and third year events yet. We've seen, Venetian Festival and all the other festivals in the surrounding areas either change their time, move, or cancel. Polka Fest, I think, got moved till August at this point. So it's gonna be quiet. I mean, I think the summer people are gonna come back. I mean, they're already coming back. I think a lot of them are leaving the metro areas because they're nervous. They'd rather be up in the clean air of Traverse City where there's fewer people. But I'm even pushing my dad, who's a summer resident, to say, you need to stay in Cincinnati for a little bit longer, Dad. We got to figure this all out before you come up here, because your healthcare system's a lot better in Cincinnati than it is up here. And if something should happen, I'd rather you be down there where you can access the professionals that you need. And have more opportunities. So it'll be interesting. It'll be very interesting. I mean, we're getting some pushback on having everything closed, but we're just trying to work together and do this together and try to make it work for everybody. I mean, we're all at risk, we're all challenged, and we're all suffering. And I think Zoom is the new normal. And I mean, we're all getting kind of used to it. It's kind of actually, fun being able to sit at home. The big joke is, are you wearing pants and that kind of thing? Sure. But I mean, it's an interesting time. So
certainly. Are there? Most of the staff didn't know that you were coming on, so they weren't necessarily prepared with any questions. But I'd offer up. Do you have anybody have any questions for the mayor before we let him go back to his important work?
My barking blind dog.
Is there anything we could do to encourage the county commissioners to represent our voices instead of their own?
It's always been a challenge up here. I mean, I'm a liberal. I'm a Democrat. I mean, I'm blue to the core. I mean, that's been frustrating. And Traverse City is this little island of blue in a sea of red. And I mean, I'm raised by conservatives. I still have family members that support Trump. It's not an easy conversation. And whether you support the president or not is a different story. But email, call, share the challenges that you have, and now's the time to do it. Send them, you can go to their website and send them emails and say, this is the field that I'm in. These are the challenges that we see, this is what we're seeing on a regular basis. Just let your voices be known. I mean, if they hear you, that's great. If they listen to you, that'd be even better. I don't know. It's always been a very us and them area. I'm just super glad I live in downtown Traverse City, and our city has, gotten way more progressive since I've moved up here in 1989. We've got non-discrimination ordinances, where we're trying to protect everybody. We're dealing with addiction in a much different way. When the harm reduction model has been embraced in our community. We're trying to treat people fairly. We're doing everything we can, and besides being renewable energy and all that other stuff. So I think we've made some great changes in Traverse City proper. But yes, the county and the region is still pretty dark. I did have a conversation with the mayor of Petoskey a few weeks ago when this was all sort of coming down, and he was in Myers, and some guy was right on him, and he just turned around and said, "Excuse me, sir, can you please give me 6 feet? We need to do social distancing." And the guy said, "Would just F off," and got into a big fight with them. And he said, he backed off. And then when he went out to his car, the guy was waiting out in the parking lot and wanted to pick a fight with him. And it's just like, that's kind of what we're still dealing with in this area. Instead of just like, let's work together here. Let's be friendly. Let's be kind. Let's all. So yeah, I call, email, check in with your county commissioners. I mean, Betsy Kofia and Bryce Hundley are good opportunities, but they're two out there. Sonny Wheelock has changed a lot. I've been rather impressed with Sonny's opinions more recently. Hopefully, others will start listening. I think Gordy LaPointe's the one pushing this sort of let's open up Traverse City more. We'll have to see where that goes. He's also, might be off topic, but he's also, they're not wanting to support this millage idea for the building of a new senior center, which is something we've been working on with the seniors for quite some time, and figured, one way, yes, is to go out and raise money, but when you have to raise $3 and $4 and $5 million, that's a challenging task. But if we did a millage, maybe for 1 or 2 years, we can get enough money to build the darn thing. But I think they're talking about that tomorrow as well. And I don't know if they're going to support the millage or not. So Those are all issues that are important. And our senior center is hugely important. That's a class of people that are shut-ins, and some of their only opportunity for socialization is being able to go down to the center and enjoy some interaction, some recreation, or some even a meal, a lunch. So those are great assets. And I've always said, Traverse City, we're the star of Michigan. We're the star of the Midwest. Everybody wants to be here. Shouldn't we have the best of everything? I mean, we hit every top 10 list that you can be on. So we need to sort of polish up our edges a little bit more and provide more services and opportunities for people. So hopefully the county will change, or the county will grow and be a little bit more open-minded about things. But yeah, keep bugging them. And emails, we get a lot of emails. I mean, some of us read them, some of us don't, but that's one way to reach out. So.
Okay, great. Any other questions? No. Well, we appreciate the historic support that you've given us, and we know you're connected to our mission, and the city has given us throughout the years. So much appreciated, and very much appreciate your time today as well. You know, in part was just, this is a hardworking bunch of people, and so it's, you know, I think important that we share that with you as well, that we're doing our part from a public health standpoint to keep our community safe.
And it's the people like you that really make our community better. In all the years that I've been in Traverse City working in the nonprofit world, I've realized I've got to interact and meet some of the best people. Our communities, the people that are willing to roll up their sleeves and work on the challenging issues, work for the various nonprofits, whether it's from the environment down to addiction services to our homeless, whatever. We're the salt of the earth. We're the people that are trying to do good. And our network like this is like a support group right now. At least we have each other to talk things through. But I've met some of the best people in this town being involved in these social issues or these nonprofit issues. So it's your organizations like yours that really make Traverse City great. And so thank you, and thank you for all of the work that you all do, and keep up the good work, because it's not ending. It's not going to end for a long time. And what you do will probably, I know addiction is a rough thing. We'd all want an end to it, but who knows if we're ever going to see an end to it with the woes of the world. So.
Well, and we see what's happening to folks right now, the mental health crisis and the addiction crisis that we know we're trying to brace ourselves for as we see people struggling through this time. So we know we need to be there for that.
Yeah.
So, yeah. All right. Well, thank you. Appreciate your time and appreciate your encouragement.
Sure thing. Thank you, and keep up the good work.
All right. Thanks, Jim.
Okay. Enjoy.
Take care. Okay. That was I just had reached out to Jim to see if he could just touch base, and as he talked about, he's been a advocate for a long time for the work that we do, and you know, we intersect in lots of different ways, and like I said, we wouldn't have the syringe program if it weren't for some of his advocacy. So and he wanted to be able to kind of express gratitude for what we're doing. So anyway, so that was kind of that was a very quick start to the meeting. Anyway, so here we are. Hey, everybody. And I think, so I wanted to remind folks, just so that you are aware, that we are recording for folks so that we can post this later. So if Matt, you want to do anything with your hair or anything, you can do that. Anything different than what's happening now. No. So today, there were no questions that were submitted to Maggie. Actually, I want to cover one quick thing first. If everybody right now, I believe, is on mute, automatically on mute. If you want to speak, obviously you can unmute yourself, but Mark taught us a new trick for those that are on a computer. Just press your space bar like a walkie-talkie and talk, and then let go, and it'll unmute you. And so that was a new trick for this old fogey. I didn't know that one. Mark taught that one. So if you want to say, ask a question or say anything, then feel free to do that way. Or as you remember from our last meeting, there is a chat button down at the bottom of the computer screen. I know a lot of you are on phones too, so I'm not as sure how that's working. So the only kind of questions from our last meeting is, and I guess a little bit of an apology, but I seem to scare the poop out of a few of you talking about the financial situation. So I want to revisit that a little bit because that's the elephant in the room. And I'm want to do it first by saying the good news, and that is that we did finally, at the end of last week, we did receive some grant funds from Block Grant and from STR money, the money, opiate response money, that was going to reallocate it to essentially cover some of our payroll deficit. So that came through, through NMRE, but that is a big deal. And so that keeps us in the short term whole and healthy. And so, but I want to show you, so I'm gonna flip over off of this Zoom to a share a screen. And so I think this will work there. Okay, does everybody, somebody give me a nod that this is, Jackie, I can see you now. Okay. So I just want to, this is a little bit in the weeds, but I just want to be able to talk about this a little bit, about how we sort of come up with our projections for where we were headed financially. So let me start with the left side of the screen, and I'll also preface this with the way our structure is set. I'm going to come back out. The way our financial structure is set is reimbursements are heavy on residential services. That is, residential services from a financial standpoint is 80% of the organization. Actually more than that. And so to scale everything out, that's why we sort of often overemphasize Dikoski, Phoenix, and Detox as those agencies that have to be healthy, and some of the other programs couldn't survive without the residential programs. And that's mostly just because we've heard this this narrative in the past that we really, as a system, we wait for people to be really sick and need the higher levels of care, residential and detox, instead of really some of these other levels that can maintain people and or prevent people from needing higher levels of care, and they don't reimburse as well. Jackie and Bill well know that if we end a month in the black in outpatient, we throw up our arms. It's just, the model just isn't built to do that. And so for us, when we look at deficit, or when we look at any financial projections, it's primarily focused on the residential programs. Is that fair? Not necessarily, but that's system-wide. That's not just us. So going back to the spreadsheet, on April 9th, when I first reached out to NMRE, we reached out and said, hey, you guys, we are not going to survive if we don't get some help. And so they said, well, prove it. So we did. So I want to just talk you through that briefly. So on April 9th, we did this analysis. We took Dikoski, we took Phoenix, and we took Detox. A bed night in January, we had 705. A bed nights in February were 752. So the actual bed nights, those total were 1,457. So that's an occupancy of 90% with an average bed per day of 24. So we were pretty full in Dikoski, in that time. And the daily rate for that's $203 a day. And you see how that plays out at Phoenix similarly. So, and we were pretty busy there, 87% occupancy. And that's combined of the months. And then the average bed night. So we had, 10 and a half people in 12 beds. So that's pretty good, and at a bed rate night. And then detox at 72. And detox is our more volatile program, right? That goes up and down much more rapidly and much more frequently than the residential programs that have longer lengths of stay. So then, and we didn't add March because towards the end of March, our census dropped. So we only took the 2 months prior to that. And then we took April 1st through 9th. So we kind of cut off March because that was just sort of all over the place. That wouldn't have been a fair representation of a month, because at the front of the month, it looked more like this, and the back of the month looked more like this. So you see what happened at Dukoski. We went to, I'll just talk occupancy because that's a little bit easier, I think, to visualize. We went to 59% occupancy, 53% at Phoenix, and 41% at Detox. And as a fee-for-service organization, we get paid these rates based on bed nights. I mean, it's just, that's the goofy math. And so the bottom line is that drop in occupancy for a April and May projected deficit of $255,000. And at that point in April, we didn't have this in the bank. So we're bringing in, revenue that wouldn't meet payroll if these deficits happen. So I'm going to pause there because I know I'm way in the weeds. I just want to be able to talk that through. Are there any questions about that spreadsheet before I click off of it?
Hey, Chris?
Yeah,
Can
Dave.
you scroll it to the left a little bit? Because you're blocking the last part of it.
If you change the view option, you can do that too.
What am I missing?
That's good.
Oh, was I not? You weren't seeing what I was saying?
Right.
Oh, I apologize. It looked right on my screen. Okay. Dave, do you want to add anything to this? Did my explanation, I should have gave this to you, Mr. CFO, but the social was trying to explain this. But
I'm just very glad that we came through with that first grant, and it's keeping us whole for a little bit longer.
right.
And we feel real positive on the next grant. So we're feeling pretty good today.
Right. So the bottom line is I wanted to come back to that. We don't always talk about our financial position at all staff meetings because there's an assumption that we got our stuff together at admin and we're going to be able to pay the bills and pay our staff. And then this happened and it was a serious situation. So we didn't, and that became, a question that got brought up. So we wanted to address it in a straightforward way. And I wanted to follow up with a little more kind of rationale around that. And so essentially that's what we asked of NMRE was, hey, we need funds that are close to this to make up this deficit. It has to happen, and because of the system that was built, and NMRE didn't build the system this way. This is statewide and really and nationally, that it's over reliant on residential care. Now we've been advocating for value-based care. We've been advocating. In fact, we have a project right now working with the Health Endowment Fund that we're hoping to kick off. It's supposed to be by the end of this year. We'll see that works with private insurance that says for every member that you have that has an SUD issue, give us X amount of dollars, and we will decide what the right intervention is. And if they need a higher level of care, so be it. If they need a lower level of care, so be it. But we get a base, a rate that makes sense. And that gets, that sort of put through the actuarial gauntlet and that they can live with as a pilot project for the state. So there's 5 organizations, us, Harbor Hall, Great Lakes Recovery Center, Phoenix House and the UP, and Midstate. So we're all working together. This is the last 6 or 8 months we've been working on this project. So we know this model doesn't make sense because this is how vulnerable we are when something like this happens. And this is how the mentality of, or I guess the stress of that can translate sometimes into, we make decisions based on money, and it's sort of built in the pudding. We've also been advocating for a less residentially reliant system. You know, before this happened, had this not happened, we would be operating a partial hospitalization program now. You know, Bill and Jackie spent time building that because that is an extension of our continuum of care that we want to do, and that we want to be able to eventually rethink, you know, how reliant we are on residential care as a field, but definitely as an organization. But until that time, oops, I don't know what I just did. But until that time, that this is this is our reality. So I just wanted to come back to that. I hope I didn't confuse things. We also are still seeking and are very hopeful that we're going to get some other, so this is state money. Well, the SDR money is federal money into the states, but so, you know, we are still hopeful about some stimulus money to help with this too, because we, at the same time, so this was just an equation of just those 3 programs of the impact. So that's where the biggest impact financially happens. But, you know, we've had to close PRS. We haven't even really looked at the impact yet because it's a little more convoluted in the clinic and an outpatient. And of course, we've had increased costs along the way too. So there, the impact isn't just that spreadsheet, but that's where the biggest chunk of it is, if that makes any sense. So, so I wanted to start there and ask if there's any questions with that, or if I can be any more specific and hopefully not leave anybody at the end of this meeting scared for their job like I did at the end of last meeting. I did not mean for that to be the case, but here we are now, able to meet payroll for the next few months, and again, we're still bringing in revenue, and we're still looking for other sources as well, and it'll happen. So any questions or thoughts there? Are folks feeling a little more comfortable? All right, I get a couple nods. So I just want to say that I know it's awkward to talk about finances, because it's hard to put the right balance and the right tone, because at the end of the day, we have to make decisions at the admin, and we run such thin margins as it is. We make decisions, differently than some other organizations. And so those, and I remember until I got into this role, how easy it is to complain or get frustrated with an agency's decisions. But I also want to know that, we're open. I'm open to having those conversations, especially if it has to do with priorities. We prioritized the porch. And so that became where some of our resources went, and that included the clinic. Before that, it was a detox facility. We prioritized that there was a need in this community, that we needed to have a better detox facility and more beds. And so that's where we put our, some of our resources. In fact, for that, we got in a little bit over our heads with that program, and we ended up having to sell a house, because as we peeled back the onion, it got more and more complicated, the construction on that. But we had to sell a recovery home. That was an agency priority. We've made up for it since, but and even before that, I mean, Venus remembers when Dukoski Hall was men, women, and PRS and detox. That was ugly. And so it was a priority for us to say, okay, we got to do something different. And so those are discussions that we want, we all just went through a strategic planning process. So I hope many of you feel that your voice was a part of that. That seems like forever ago now because we're in kind of crisis mode, but we're still trying to tend to those strategic planning goals as well. So and Tim, yes, sorry, Tim remembers too, back in those days. Yes. Yeah, Tim, you've been around a minute. So that's for sure. Good to see you, man. Any other questions around that piece, or what are our priorities moving forward, or anything around in this world? No. All right, I'll take the silence as a no. So I also wanted to, because I think it's been important to be able to hear less from me. I want to be able to be accessible and answer questions, but you all are doing, the real, hard day-to-day work. And so I wanted the managers to be able to just kind of touch base on what's happening in their programs like we did last time. And so we're going to just do a kind of a quick kind of programmatic update. And again, feel free to ask the managers, what's happening there. And I'm going to start with you, Venus, if you don't mind, just giving us a little bit of an update on kind of how the Access Center is going and working from your remote locations, and kind of, I'm curious too, just anecdotally about what's happening on the phones.
So, the phones were the biggest challenge for us, and they still are a little bit challenging. Initially, all of the phone calls were going through Dan, which slowed things down considerably. Dan likes to be very thorough with the clients. So we realized right away we had a bottleneck. So we addressed that. Mark got us set up so that we're all working through Google Voice. That has its own challenges because it dictates very poorly. People keep calling me Dinas, so I don't know.
Well,
but,
could be worse.
Could be a lot worse. But it is working much better now. We're able to respond. Every morning I go through the call center calls the night before and make sure that everybody gets a return call of some sort. So it is getting a lot better. And I have to say, I have the best team to work with. Nicole is keeping the money rolling through. She's doing a great job. Yeah. Megan and Dan have been on the phones with the clients and really doing the best that they can. We don't schedule the clients any longer. That's being done by Susan, primarily through Susan giving us permission to schedule them, and Paula. And I just want to do a shout out to Susan and Paula. Man, they are like 24/7 working. And I don't know if you've ever been there, but every time you take a bite of food, the phone rings, so it's really, really stressful for them, and they're doing a great job keeping everything running really smoothly. So, but team is working really well together. Everybody's working really well.
Great. Thanks, Venus. Much appreciated.
Welcome.
All right. Hey, Bill, do you have any updates out of outpatient?
Since last time, no. We continuing to run the extra groups, the 5 extra groups in the recovery homes, to kind of help with processing what's going on there in their natural environment. I got 2 clinicians in the office currently, myself included, 2 working from home remotely. So that's working out well. So we have a presence in the office as well as in the community. Groups, gotten a lot of positive feedback from community members thanking us for the the extra groups, as well as just being present, because a lot of places can't run groups or they don't have as much availability, and from staff as well. Today, for anonymity purposes, I won't share her name, but one of my staff members shared her gratitude, really more to you for allowing her for a place to come to work during these times. So that switch towards gratitude and the fear kind of stabilizing has been kind of a nice change. But other than that, programmatically, things are continuing to plug along. You had mentioned 2.5. Jackie and I are still talking and working on that. So,
Right. Yeah, we know that's on pause for sure, but I'm confident that's going to be a great service for our community.
so it's exciting. Yes.
Right. I just talked with Max Johnston from IPR a little bit ago, and it was more around MAT, but he was asking about the effectiveness of outpatient services, because he has been hearing positive feedback about how that interaction looks for folks, or feels for folks, or is functioning for folks. And I have to say, at least, maybe I said this the last meeting, I can't remember, but from my meetings around the state, it's shocking how many organizations have really said, oh my gosh, like, we don't want to go back, or at least have this has to be, and it's from folks that would have never envisioned it before. Like, no, there's no way that could work, to, wow, they're getting a lot of feedback. And then I'm not trying to say it's been perfect or anything like that, and there's glitches and it's not for everybody, but I think I shared with the clinical team this week that there's already work groups happening at the state that are putting together the recommendation for Medicaid and providers to have this be part of the moving forward reality in the long term, is to be able to offer telehealth, and we're going to grab some data on the no-show rates. Dr. Plum told me today she had 100% show rate for everybody that showed up for her appointments. When does that happen?
I don't know.
So, wait, go ahead.
It was just it was 2 new evals and I think 3 or 4 follow-ups, and it was a very busy morning, and they were all virtual. And I've been very pleased with Danny's work in terms of helping the patients. And I mean, I'm doing my job, and I see that the next person is in my waiting room, and I admit them. So it's pretty cool. So, but I do. One of the patients today though did say, we're having the interview, he's in his car, and he's like, I want to meet you in person sometime.
Sure.
I think it's the way we approach it at CMH is like, we like to have a mix. We don't like it to necessarily be everything that we do.
And yeah, and I see that's what happens moving forward, is that it's, and it's going to be client specific, because we do have folks with transportation barriers or other sorts of barriers that this might make sense, but not necessarily as a replacement. But it's going to be in our tool belt for sure. So that should be interesting. All right, and how about Karen? How you want to say anything about what's happening at Dukoski?
Sure.
Well.
Hi.
Okay.
Can you did I take the face out of there?
Oh, good.
We good? All right.
You're fine.
Good. Right now, we're at full house. Full house right now for us is 23. We just lost someone today, but it looks like we're gonna maintain a steady 23 for
Right.
the time being. Programming as usual, except for our meetings. We don't get to do the outside, obviously, so we're doing the Zoom stuff too. Staff and clients have been doing pretty well at hanging in there. As most of you already know, Patrick has initiated creating a slideshow of staff, the ATS heroes, and that will be hopefully set to music that a client has written and sung for us. So that's pretty neat.
Cool.
And yeah, we're just trying to get creative, get the guys outside a little bit more, that kind of stuff. Everybody's been really, really doing a good job and very unified.
Good. Good. Yeah. And thanks for that. And you know, it reminded me, oh, what was that? Reminded me that one of the things I meant to say relative to the spreadsheet was that was our moment in time and the projection forward. So then, because we didn't know what was going to happen, so that was the asterisk. So now as our census goes up, then the reverse happens, right? So now we are having a different revenue than we were having then, but we don't, you know, we just don't know. And so, you know, that's the reality. But luckily those funds are grant funds as opposed to advance. You know, the first bit of money we got from Anna Marie was just an advance that we're gonna have to pay back at the end of the year. These were grant funds. So if they'll be able to, you know, and it's not in the scale of thing, that's not a ton of money, but as we bring in, you know, it allows us to maybe do some other things with that as well. So a good reminder. Yeah, because then all of a sudden, you know, our census has went back up. I think people, and I know somebody that works at an urgent care, and they're starting to see more people come out too. I think for a while we all just hunkered down. So
yeah, this keeps us going longer. I mean, with our census up, you know, it was looking dire a couple weeks ago, 3 weeks ago, and now the census is starting to come up. We got some extra money. It just lets us weather this storm, and we're going to come out of this stronger. And
right,
keeping that census up, it's really great.
Right. But we're not. But our perspective is we want to be there for folks. We're not trying to force census, right? Like that's why we didn't sweat it when it did go down. Like we sweated it from our end of things, but we weren't trying to do anything different. We didn't have Venus walk up and down 8th Street with a sandwich board sign or anything. So, you know, we're weathering it. That helps us weather. That's right, Dave. Next on my screen is Paula, but Paula, I want to do a quick little thing first. That the other day Mark found some old photos, and so later this year marks the 5-year anniversary of the new detox unit of the pier, which I can't even believe it's only been that, you know, it's already been 5 years. But so Mark found some photos and put this together. Also, Dave, you're on my screen. Can you nod if you can hear me? Dave, okay. So I want to say there's a guest star in this, which some of you might know. The chicken that lives across the alley kept coming to visit. So that's the guest appearance you'll see. But this is the construction of the pier. How's that? Thanks, Mark, for creating that for us. That project was the most complicated mess of a project. Remember that, Mark? I think we got our first bid was, we can do this for 50K or something.
Yeah, right.
And then
And
pretty
we found
soon,
that contractor.
yeah, that you can see that was more than a 50K project. And then they told us that we had to shut down 8th Street in the middle of, was it July?
It was.
For
Yeah.
3 or 4 days, because we had to have thicker water to do the sprinkler systems. It was a mess. So
That's a safe building.
it just it
Really.
is. So anyway, so I wanted to give you that little preview there, Paula. You are still on mute. Got it?
Sorry.
There you
my
go.
phone. No, you had, I'd seen those before. You had sent a CD of,
Oh yeah.
yeah. So that was cool to just see kind of where it came from and where we're at now. And even, you know, the changes that have been made in just the last few months of
Yeah, right.
the flooring. I mean, the little things that just make things a lot, you know, just more sanitary and things like that. So
Right.
it's pretty amazing to see what happened. So
What it's evolved into, yes, for sure.
yeah, very cool. And I think, you know, as we, I don't really have too many updates. You know, we are still doing the census for detox. As you said, you know, we go up and down, up and down. We went down a lot further than we had been for a really long time. And I think it was, you know, because of everybody, you know, COVID-19. We saw an upsurge last week. You know, kind of went down a little bit, but, you know, I'm confident that it's going to go back up. I think more people are being confident about reaching out for help again. The need is there. It's always going to be there. I mean, I can agree that, you know, it's probably more now because there aren't a lot of community resources for those of us in recovery. So I think we're going to be seeing a lot more relapses and people finally, you know, just coming back in. We are still doing the screening, the COVID-19 assessment things on everyone. Julie has been a huge, helping me with that, and obviously with medical questions that I've had. Access has been, you know, helpful with that. You know, the staff here has just been doing an amazing job of just adapting. You know, the nurses, they are just doing their job. You know, they are just stepping up to the plate. You know, they don't just do nursing here. You know, they do continuation of care. So when they're talking to them about their symptoms, they're asking them the next steps of what's in your recovery plan. They're asking them, you know, okay, what are you going to do different this time? You know, they're just not your typical, I'm just going to, you know, take your blood pressure. Are you feeling this and that? And then that kind of coincides with, you know, our navigators who, you know, are taking maybe not literally the pulse of what's going on with the clients, but they're also kind of helping them through what's your next step in continuation of care, but understanding that our people are sick. They're not always feeling 100%. And it's like, you know, to get on the phone and call NMRE, things like that. And then you have Linda, who's our case manager, and she's, you know, just jumped in there and just taken on, just taken it all as far as like doing groups, doing a continuation of care for people. She's actually sitting down with people and doing their treatment recovery plans. That was something that wasn't necessarily going on with everybody. It was like, okay, do we have time to do this? But now with her on board, we brought her on, I feel like it's been almost 8 months now, maybe 6. You know, she's been doing that with everybody, which has really helped with people having something more than just saying, yeah, I may or may not do residential, I'm not sure. So that's been pretty exciting. And so that's all still going on in the midst of everything, in the midst of COVID-19 and people, you know, being frustrated that there's multiple steps to get in, but also at the same hand, they're frustrated, but they think they're understanding too, that this is what we have to do to keep everybody safe. So we're just plugging along. That's about it.
Great. Yeah, I also spoke yesterday with Patrick Sullivan, who's a reporter with the Northern Express, and he's going to do a story around the impact of this. I actually put him on to Tori Worth, who's doing great work. But one of his questions is like, yeah, you guys are open, but man, you must not be doing anything. You're just keeping people safe, right? No, we're still providing care. Like, and he was shocked by that. He's like, how are, like that, I mean, he was just surprised. And he was surprised, A, that we were even open, but that B, that we were actually still meeting our program needs, or program requirements, and that, but we're doing all that in the midst of our managing our own crisis. So, yeah, great job, Paula and team. Susan, you have anything to share from your team?
I just want to say ditto to what everybody kind of has said about, I think, us all kind of working together and being in communication via email and phone call. And,
yeah,
I like having my check-in with Paula time and my check-in with Access time and Karen and Andrew time. We're all just talking a lot in various ways, and it's great. I'm just proud of my team members and the houses for the resilience that I see in sort of settling into, I don't like the phrase new normal, but I think like trying to find their rhythm in all of this. My clinicians just keeping up with their clients' needs, the authorizations, the documentation that comes along with this, with that added sort of layer of, I think, difficulty concentrating that we all have at various parts of the day right now. And I'm very proud and impressed by them. I think that clients and staff at both houses, again, are just feeling quite unified and trying to focus on what's important. So yeah, it's been really impressive to be a part of. I feel like right now I'm outside of Dekoski and there's like all this wildlife that is happening right now. So sorry if I'm making faces. There's ducks that have nested under Dekoski, and there's like birds all over, and I don't know. There's like a lot of wildlife happening. So that's fun. So yeah, I'm super proud of my team. I think naturally, because of just people, I think, realizing that this is going to be something that's happening, and that we're navigating for a long time with COVID happening, that clients are reaching out now. We're getting a lot of those people interested who are coming to detox and continuing care, or just coming right into residential. We're starting to move some of our clients right into recovery homes. With Ernie, just had somebody leave today who I got to come over and set Zoom up on his phone before he left because he doesn't know how to do Zoom, and just those little things like that I think are really helping people feel like they can navigate the next step is important. So yeah, it's been a pleasure to watch.
That's great.
Yeah,
thanks for sharing.
Thank you guys.
Now I'm not seeing everybody on my screen, I don't think. Is Ernie online? I don't think I see Ernie.
He's doing an intake right now,
He's
Chris.
doing an intake with the lovely guy that's
okay. All right, great. And Andrea, is she here? Yeah, there she is. How's it going over at Phoenix, the masked trio?
There's actually 4 of us in here.
Oh, okay.
Autumn's hiding down over here.
Okay, that's social distancing. Well done, Autumn's hand.
We're wearing our masks.
Well done. Well done.
No, we're doing pretty good over here. Staying busy and doing what we do, providing the services that we need to. I continue to remain impressed with the way that my team is handling everything that's being thrown at them through this whole process. They come to work every day and wear their hearts on their sleeves and take care of everybody. Marnie has stepped up to do some auditing and
Oh.
learning that process with Patrick. So that'll be a big help to have those extra eyes and files. I know Marcy and I have spent a lot of today working on the NMRE audit to kind of, stay on top of that.
Life still goes on, doesn't it?
Oh, yeah. So yeah, I think that's not much has really changed per se. We're still coming, we're still doing what we do.
How are the ladies doing, the clients, the residents?
They're doing really well. Mask wearing is gotten a lot better.
Okay.
Not having to get after them as much to remember to put it up over their nose.
It works better that way, yes.
And not taking it off to talk. That's been another big struggle, but it's gotten a lot better.
Okay. Good. Well, thanks for all that you're doing over there. All right. Are there any other updates from any other program or department, or any questions from folks? I think.
Matt.
Oh, go ahead. Yeah, Matt. Oh, yeah, Matt. Sorry. Sorry,
Matt.
Okay.
I get it all the time. I do want to say, I mean, we know people are struggling out there, and we are doing everything we can to stay connected. One of the things that I want to make sure that everybody is aware of is that our Safe Syringe program is still open and operating. We are seeing people, I think, in response to what Chris was talking about, a lot of the people that have heard stories in the media that we're actually operating, we're starting to see people reach out more for the Safe Syringe program, and we have a lot in the naloxone kits. If anybody out there, our therapists or anybody externally, if we need to get those delivered, I will personally deliver as many naloxone kits as need to be delivered out there as we can. We want to make sure people utilize those. And big shout out to Maddie. She's doing a great job of connecting the porch with a lot of different organizations and bringing in some great guests for the live show. Monday notwithstanding, we had the CEO of ATS on there. Quite frankly, we're all still recovering from it, but they did a great job.
So is he.
If there's any need for naloxone kits or anybody who needs to plug in with a recovery coach or with the Safe Syringe program, please don't hesitate to let us know.
Okay, great. And that's part of the reason that we're still trying to connect with media, is for that reason, is so people know that we're a resource for them. Like, the reason, so when Patrick Sullivan contacted me, I wanted to make sure that it wasn't about us or about our residential programs. It was about what's happening in the broader community. And so that's why I tried to talk about what's happening in the porch. And then I put him over to Tori Worth, who's doing a lot of stuff with the virtual recovery, so that we can give a kind of a comprehensive sort of, view of what's happening. And I'm sure we'll, and the same thing with Matt Sanderson at IPR, and, Matt and Maddie have been, doing their show, and they've been doing, they did the 7 and 4 bit the other day. So, we're still trying to have a presence in the community so that, folks know that we're there for them. And that's been, our motive, is because, again, we know folks are struggling. So,
and just to piggyback, I mean, what the mayor said, we know that consumption is way up, alcohol sales are way up. Just anecdotally, we know from the stories that we're hearing through the porch, people are relapsing, and we need to be there and be ready when this thing is over. So it's important that we get that. Well, people are shocked that we're open. It's the most common answer is people are shocked that we're open.
Yeah, right, for sure. Well, you know what I got from one of the reporters, which just speaks to a bias, so I won't say which one, but the fact that we would be considered life-saving and life-sustaining still hasn't resonated with a lot of people. That we, I don't know what the alternative to that is, but that there's an option for folks somehow, right? And so that we wouldn't be essential in that regard was kind of surprising. But anyway, if that makes sense. All right, any other updates, questions, thoughts, ideas? I think the plan is that we'll still do this every other week. We'll probably reach out to think about another format or other content, just so that it isn't, again, mostly me talking and then doing another round robin, but maybe we'll do something a little more structured, just to make it meaningful. So we'll reach out for ideas. You know, we're still learning how to make this meaningful and helpful. We want to be able to respond to questions. We want to be transparent, but we don't want to, we want to honor your time. So, if you have those kinds of, that kind of feedback, then please share it one way or another. And then I guess to end, unless there's anybody wants to chime in on anything, this is a weird format I want to keep pausing and making sure I'm not cutting anybody off. So there's my pause. Then to end, I guess I was just reflecting on the energy and the positiveness and the kind of organic nature of the last week around our staff taking photos with the signs and some of the good things happening from the community support and us really embracing this concept of doing heroes work, because I think that's true 100%. I think for a lot of us, just getting in our car and coming to work, as Susan alluded to, finding the focus to get our work done is hard, because while I think that's important and critical that we give ourselves that permission to rally around that, we are still humans and we have to tend to ourselves, and that's part of heroes work too. So whatever the agency can do to help you support your own health, your own well-being, we want to do that. Please don't forget we have the emergency fund. Please don't forget we have the EAP. We've got, we still have the wellness work, and then we want to think about some other way that we can, have some other initiatives support us, because we're in this for a bit, and we have to tend to ourselves. And I think that energy is great, and it's fun, and it's important and critical, and I'm glad that's happened. But we got to honor our humanness too. So whatever we can do to support that, we want to do that. And so thoughts and ideas that you have around that, let us know, let me know, let Maggie know, let your supervisor know. And we're going to keep thinking about that as well. On a smaller note, this Friday, one of our board members, Sam Botner, and the company she works for, which, gosh darn it, I apologize, it's not going to come to me, but I'll give an official announcement. But she's going to they're going to be bringing meals to all 3 shifts on Friday. She said lunch, and I said, yeah, well, they always get stuff, us folks that work during the day. And so they're going to be bringing runs for lunch at dinner time, and then also they're going to drop some stuff off at midnight. So I'll give more details on that, but it's just nice to see the community realize, maybe to Matt's point, oh, you're still open, and wow, that's important work. So it's nice to see that being supported in that way. So appreciate everything everybody's doing. Any other closing thoughts, or we say goodbye? All right. Keep on keeping on, y'all. Good job. Thank you.